How do pathologists differentiate non-seminoma teratoma types? Imagine you're looking at a complex puzzle made of many different pieces. Pathologists do something similar when they examine non-seminoma teratomas. They analyze tissue samples under a microscope to identify the specific types of tissues present, which helps determine the exact kind of tumor. This process involves looking at the tissue's appearance, its level of maturity, and whether it shows any signs of becoming more aggressive. They also use special stains, called immunohistochemical markers, to highlight certain proteins that are characteristic of different tissue types. For example, markers like SOL4 are commonly found in germ cell tumors and help confirm the diagnosis. Cytogenetic analysis is another key step, where they look for genetic changes such as the presence of an extra copy of chromosome 12p, known as isochromosome 12p. This abnormality is a hallmark of germ cell tumors and helps distinguish malignant tumors from benign cysts. Pathologists also consider the tumor's overall structure and features seen on imaging and in tissue sections. Mature teratomas contain well-differentiated tissues like skin, cartilage, or glandular tissue, which resemble adult tissues. Immature teratomas, on the other hand, include embryonic or fetal-like tissues, often with neural elements that look less developed. Identifying immature neuroectodermal tissue is important because it indicates a more aggressive tumor that may require different treatment. Sometimes, teratomas can undergo malignant transformation into other types of cancer, such as sarcomas or primitive neuroectodermal tumors, which also influences how they are classified and managed. Another factor is the presence of intratubular germ cell neoplasia, or IGNU, in the surrounding testicular tissue. This precursor lesion is often seen in postpubertal teratomas and helps differentiate them from benign cystic lesions like dermoid or epidermoid cysts, which lack IGNU and cellular atypia. When pathologists encounter mixed tumors that contain elements of teratoma, along with other germ cell components like embryonal carcinoma or yolk sac tumor, they carefully identify and quantify each part. This is crucial because the most aggressive component usually guides treatment decisions and prognosis. In essence, pathologists combine microscopic examination, genetic testing, and immunohistochemistry to distinguish different types of non-seminomatous teratomas. They look for tissue maturity, genetic markers, and associated precursor lesions to tell apart benign cysts from malignant tumors and identify any malignant transformations. This detailed classification is vital because it directly influences the treatment plan and outlook for patients with testicular cancer, which is a major type of reproductive cancer. Always remember, for any diagnosis or treatment questions, consulting a healthcare professional is essential to get personalized advice based on individual circumstances.